All right, call the roll.
Senator Norman. Here. Senator Newman. Here. Senator Obenshain. Here. Senator Lucas.
Here.
Senator Spruill. Here. Senator Edwards. Here. Senator Deeds. Senator Barker. Senator Marsden. Here. Senator Eben.
Here.
Senator Lewis. Senator Serval. Here. Senator Mason. Here. Senator Bell.
Here.
Senator Saslow.
Here.
Mr. Chair, you have a quorum.
All right, the first bill is Senate Bill 5022, Senator Kiggins. You're up.
Mr. Chair, thank you. Thank you very much. This was the bill that there's actually 4 bills that are very similar that covers workers' comp for law enforcement. My bill is workers' comp for law enforcement, first responders, and firefighters. There's multiple bills in this committee docket that deal with that subject matter. Mine is a little more restrictive, and the other 3, I believe, are a little broader in scope. So I don't know if we would like to roll. I would like to roll my bill into one that's perhaps more broader in scope.
Mr. Chair. Mr. Chair.
Yeah, Senator Deeds.
Senator Kiggins has described it exactly. What her bill does, it doesn't include a retroactivity clause that your bill, my bill, and Senator Vogel's bill includes. And I would move that we roll all 3 bills, Senator Kiggins, Senator Vogel, and my bill, into your bill, which is Senate Bill 5066.
Second.
Mr. Chair, I agree.
Clerk, call the roll. We can go. You what? Okay. All those in favor of rolling those 3 bills into mine, let me get the number. All right. 50. So it's going to be 5022 into 5066, and also yes, 5104, Senator Deeds' bill, and Senator Vogel's bill is 5097, all into my bill.
5066.
All right, all those in favor of rolling all those into mine, say aye.
Aye.
All right.
Mr. Chair, I move we report the bill and refer it to Finance.
Mr. Chair.
Did you say refer to Finance?
Yes.
Yes, okay.
Mr. Chair.
Yeah, Senator Bell.
Mr. Chair, I would just ask that we make an amendment that we include correctional officers into this bill. They're frankly in harm's way and perhaps one of the most dangerous places. It's a smaller group, and I think frankly adding them to this protected group would be a positive thing. We did add them to the presumption of disability in the last session.
All right, you heard the motion by Senator Bell. Is there a second?
Well,
the bill has to go to Finance.
If I could speak to that, Mr. Chair.
All right.
Could I
All
speak?
right, all those in favor of adding correctional officers.
Could I speak to the amendment?
They're already included.
What? All right. Pardon? Can I speak to the amendment? I can't hear you.
I'm sorry. Can I speak to the amendment?
Senator Deeds.
I think it's truly worthy to add correctional officers, and there are probably other classes of public employees like teachers that ought to be added to this bill. But you've got to remember that the more people we add to this bill, the more expensive it becomes. And my concern about adding any group is that this becomes so unwieldy that it cannot become law. And certainly the bill has to go to Finance, and at that point, we will have the ability to consider adding other groups if it makes fiscal sense.
Mr. Chairman, if I could speak to that?
Senator Bell.
I certainly appreciate the comments of Senator Deeds. Frankly, we have 14 types of peace officers in Virginia. I asked to add 1, and that's our correctional officers. They're in a closed environment. We've heard testimony yesterday and today. This is a very high-risk group. And frankly, we know they're getting exposed. Once it's in an enclosed environment, it's highly likely for them to have a good chance of contracting it. My heart goes out to teachers. My mom is a retired teacher, and I would love to include them. I didn't include them. I didn't ask for that. I just asked for correctional officers because I know the funding is tight. So even though I know it's tight, I'm not asking for the Christmas tree list, but I do think this group is really in harm's way, and I think we need to have their backs in this crisis. Thank you, Mr. Chairman.
Senator Deeds, did you want to?
Mr. Chair, correctional officers, I've got some that have been among my best supporters, and I'd like to include them, but I think it's more important that we get this clean bill to finance where we can take a look at the fiscal issues, and then perhaps we can add correctional officers, and we can look at who else we can add or subtract.
Mr. Chairman, substitute motion.
Senator Norman?
I move that we delete firefighters and substitute correctional officers.
No, all right. Is there a second? Second, all right. The motion is to delete firefighters and add correctional officers. I would hope that we wouldn't do that. The purpose of putting in the bill was initially to cover firefighters, but all right, let's have a vote. Clerk better call the roll on this.
Senator Norman. Senator Newman. Senator Obenshain. Senator Lucas.
No.
No.
Senator Spruill. Senator Edwards. No. Senator Deeds. No. Senator Barker. No. Senator Marsden. No. Senator Eben.
No.
Senator Lewis. No. Senator Serval. No. Senator Mason. No. Senator Bell.
No.
Senator Saslow.
No.
Senator Newman.
All right.
Ayes 3, noes 12.
All right. We need to take the vote on adding. I would recommend that we go ahead and add that. We'll get the cost on all of these categories when we get to finance. Senator Deeds, let's go ahead and do it that way. All right. All those, see if we have unanimity here. All those in favor of adding the correctional officers, say aye. Aye. Opposed? No. Ayes. That's the ruling of the chair. The ayes have it. All right. The motion. We need a motion to report and refer to finance.
Second.
All right. There's been a motion to report and refer. Hold on. 5066 as amended to Senate Finance.
Mr. Chair, are there those in the room that would like to speak to the bill, members of the public?
Hold on. They can get a chance in finance, but it's there are a total of 6, 7, 8, 9. There's at least 9.
Can you put a 5-minute limit, Mr. Chairman, on those?
All right. Just express your support or opposition. We have 9 speakers, and try to confine it to less than a minute. The first speaker we have is John Jones. Going once.
Good afternoon, Mr. Chairman and members of the committee. The Virginia Sheriff's Association very much supports this bill. We appreciate the support from the members of the Senate. We have a lot of deputy sheriffs around the state that are exposed to this stuff all the time. Some of them have permanent disability as a result of it, and I appreciate your support. Thank you very much.
Thank you. Next is Ed Rhodes. Ed Rhodes?
I'm right here.
What? All right.
You hear me?
Next. Next is John Hurd. Ed Rhodes is there.
Yes, sir.
All right, Ed, go ahead.
Thank you, Mr. Chairman. All I want, on behalf of the Virginia Association of Rescue Squads and the Virginia Association of EMS Administrators, we appreciate the work you've done on this bill, and we look forward to working with you in finance. And thank you very much. And that concludes, we support it, and that concludes my remarks.
Thank you, Ed. All right, the next is John Rhodes. Excuse me, John Hurd. He's not there.
Don,
What's he doing?
got a press conference.
The next is Tiffany
I was talking to Mamie about
Fink Haynes. Not there. David Bailey.
Well, Cree and I've been saying it's a real problem because there's a lot of important stuff that goes through there. There's no lawyer.
Okay.
We'll talk to landlord.
David Bailey.
Yes, Mr. Chairman.
They don't like it.
David Bailey, on behalf of the Virginia State firefighters, primarily the volunteers, thank you, and all the patrons and the committee. We support the bill.
All right, thank you. The next is Mark Dix.
Good evening, Mr. Chair, members of the committee. Mark Dix on behalf of the Virginia Trial Lawyers Association. We'd like to thank the various patrons that brought these measures, and we wholeheartedly support them. Thank you.
Thank you so much. Chris Legault. Not in there. Jeremy Bennett.
Good evening, Mr. Chairman, members of the committee. Apologies for the feedback. Jeremy Bennett on behalf of the Virginia Association of Counties, and though the intent of the legislation may be well-meaning, we must share our concerns that the extension of workers' compensation presumptions for COVID, in addition to other recent changes in the workers' compensation program, could result in substantial fiscal impact to local governments. And we strongly urge the passage of any legislation that expands presumptions to include COVID-19 be done only if in concert with additional state funding to assistance to local governments to offset additional costs for our risk insurance.
Thank you very much. Aaron Rice.
Good afternoon, Mr. Chairman. Thank you for the opportunity to speak. I'm Erin Rice, and I speak on behalf of the Virginia Professional Firefighters. We do support the legislation. Just wanted to make a quick note that our firefighters are on the front lines every day, and we have already had over 130 firefighters that have been diagnosed with COVID. Of that, 11 of them have been hospitalized, and we have one individual that I know will not be returning to work due to the complications from COVID. So this is a serious issue for our firefighters. It's not a hypothetical, and I appreciate your support in making this a presumption for those individuals. Thank you.
Absolutely, and thank you. Next is Wesley Melson. Wesley Melson.
Thank you. Thank you, Chairman and members of the community. On behalf of the Virginia Association of Volunteer Rescue Squads, we support the bill and we appreciate your support. Thank you.
Thank you. The next is Brent Rawlins.
Mr. Chairman, Brent Rawlings for the Virginia Hospital and Healthcare Association. We appreciate the intent to support our frontline healthcare providers. We want to do all we can to assist them in this time. We do have some concerns, however, with respect to the scope of the presumption, but it would apply to any employee that's a healthcare provider, whether or not they're directly involved in patient care, and whether or not they have a potential exposure to those with COVID-19. An example would be someone working, a healthcare provider working in more of a professional role, doing chart review or telehealth from home where they don't have risk of exposure. So we just do have some concerns about the scope and potentially tailoring that. And also would be helpful to potentially clarify some of the evidence required to overcome the presumption, just so that we're sure that we strike the right balance and that we're hitting the target here that we want to provide the help to those that need it most. Thank you very much.
Okay, thank you. Donald Baylor? Donald
Yes.
Baylor.
Can you hear me?
Yes.
Okay. Yes, I represent the correctional officers across Virginia, and I just want to put a few numbers to their condition. As of yesterday, we had 117 employees who were positive for the coronavirus. And they work in this enclosed environment that have so far had 2,555 of the offenders that have been exposed to the virus. Currently, there are 445 offenders that are currently in the facilities that are positive for the virus and 7 in the hospital. They are really in the mix of this. They are in an enclosed environment, and I think these are one of the most affected groups of all public safety at this point.
Okay, thank you very much. All right, that concludes the...
Senator, we do have 2 more. I'm sorry. We have Chris Legault is on the line.
You have who?
Chris Legault.
Okay, I'm sorry. I must have missed Chris.
Chris?
I apologize. Chris?
And tell him I'm here too.
Mr. Chairman, can you hear me?
Yes.
Good. Thank you very much. Yeah, we were trying to get on, and unfortunately, the mute button didn't work. In any event, I'm not here to oppose or support the bill, but am neutral on it. I do have a substitute bill drafted to address the concerns that we have, and I want to give you a national perspective of what's going on across the country with regard to workers' comp presumptions for COVID-19. I'll do all this in front of the Senate Finance Committee tomorrow, I assume. And John Hurd is also here and would like to speak as well while we've got the mute button turned off. So thank you, Mr. Chairman.
Mr. Chairman, this is John Hurd.
Okay. Go ahead.
Okay, I am unmuted, it says. Thank you, sir. I'm here today to talk on behalf of the Virginia Self-Insurers Association and Metis Holdings, the company that oversees the administration of all the workers' comp claims and liability claims against VACO's risk pool. We actually do oppose this measure for a variety of reasons. I will be very brief.
Good. Brevity is important.
First, I understand. First, the bill creates a so-called rebuttable presumption. It's retroactive to January 1st, 2020, which is before the virus was even known to have arrived in the U.S. or Virginia. Now, whether the presumption is actually rebuttable is highly questionable in our minds, as employers attempting to overcome it may well have to wind up being required to prove that the employee did not contract the virus during and in the scope of their employment, and also prove where they did contract it. That's a very difficult burden in a full-blown pandemic. I'm also told by a number of attorneys that the retroactivity provision of the bill is almost certain to be challenged in court. While I'm sure it's intended to keep the people who may have contracted the virus in the early days of the pandemic on even footing with those who contract it now, it's very unfair to employers and their insurers, and in combination with the presumption will encourage the filing or attempted refiling of many more claims. Insurance, as you know, is predicated upon underwriting known risks and collecting sufficient premiums to cover those risks. And on January 1st, nobody knew the potential impact of this virus. Sufficient premiums have not been collected, and we still don't understand what the latent medical effects of this virus may be. However, we are starting to understand what the cost of COVID-19 workers' comp claims could be in Virginia under this sort of presumption. If this bill passes, we've got some recent actuarial data and analysis prepared for VACO's risk pool and provided to me by my client. It shows local governments are looking at paying a conservative estimate of $20 million in COVID-19 workers' comp claims for firefighters, law enforcement officers, and first responders through June 30th of 2021. Now, the same actuarial data and analysis showed that workers' comp claims for other types of employees covered under this presumption are projected to cost $8.50 per $1,000 of payroll. For local governments already hit extremely hard by this pandemic, that's a huge added cost. And many of those local governments have also not been able to secure excess insurance after June of this year for COVID-19 workers' comp claims because the excess insurers are putting infectious disease exclusions in their policies. This means these local governments will be covering all these costs by themselves. And because medical treatment costs for any unknown latent impacts of this virus will become the responsibility of the employer under the lifetime medical coverage requirements of our workers' comp law.
Can you wrap this up in the next few seconds, please?
I am almost through, yes. The cost information I just provided you can only be expected to increase. We'd ask that you not favorably act on this legislation, but if you do, we would certainly request the Commonwealth provide some additional funding assistance to local governments to help offset these additional costs. Thank you, Mr. Chairman.
Okay, the next speaker is Wayne Huggins, followed by Mary Kay Goldschmidt.
Thank you, Mr. Chairman. On behalf of Virginia State Police Association, we wholeheartedly support this measure. As with some of the other groups, we've had any number of troopers who have tested positive, some displaying severe symptoms, and we very much appreciate your support as well as the other senators who Deeds and Kiggins and Vogel. Thank you very much, and we wholeheartedly support the bill.
Thank you. Thank you, Wayne. Next is Mary Kay Goldschmidt.
Good evening, Mr. Chairman. I am the Commissioner on Government Relations for the Virginia Nurses Association, and we're over 100,000 strong. We ask the Commonwealth to answer the call to support us as we have cared for Virginians, and we support this bill and appreciate your service to our profession. Thank you.
Okay. Any more speakers over there? That's it. All right.
You've got a motion, Mr. Chair, to
There's a motion
report and refer.
before us to report and refer to finance. Clerk, call the roll.
Senator Norman.
No.
Senator Newman. No. Senator Obenshain. Senator Lucas.
Yes.
Senator Spruill. Yes. Senator Edwards. Yes. Senator Deeds. Yes. Senator Barker. Yes. Senator Marsden. Yes. Senator Eben.
Yes.
Senator Lewis. Yes. Senator Sturgill. Aye. I'm sorry. Aye. Thank you. Senator Mason. Aye. Senator Bell.
Yes.
Senator Saslow.
Aye.
Ayes 12, noes 3.
All right. The next bill is Senate Bill 5027. Patron is Senator Newman.
Mr. Chairman, if it pleases the chairman, we may be able to roll Senator Stanley's 5078 into my bill 5027 at his concurrence. Mr. Chairman, would you allow us both to present? This is kind of a brains and looks thing. He's got the brains and he's got the looks, and I'm going to have the bill number. So.
You don't want to put that to a vote.
No.
Remind me I have to pay Senator Newman for that comment.
All right. You've heard a motion to roll it into yours?
Yeah.
All right. The motion is to roll. Senator Stanley, what's your bill number?
Mr. Chairman, my bill number is Senate Bill 5078.
To roll 5078 into 5027. All those in favor say aye.
Aye.
All right.
Mr. Chairman, I'll go first. Mr. Chairman, as you'll recall, your bill passed this last session related to collective bargaining. During that session, we talked extensively about police officers and sheriff's deputies. During that time, we did make sure that sheriff deputies who are constitutional officers were not included into your bill. What we did not do, and I would think by mistake as we spoke of them in general terms, is we did not include police departments. Mr. Chairman, this bill does include police departments. I feel clear that at this time it is a time that we certainly want to pass this bill As you know, Mr. Chairman, there have been a number of times whereby we have had police officers who on rare occasions have acted contrary to the public interest, and during those times in other states, those particular individuals have been protected by that union. As a matter of fact, those particular individuals at many times had multiple items that were pending against them, but there was no way to remove those officers because of the unionization. Mr. Chairman, this bill is quite simple. It just adds on lines 41 through 46 that there will not be a collective bargaining for law enforcement agencies that are added to the sheriffs. And, Mr. Chairman, with that, I'd like to yield to Senator Stanley.
Thank you, Mr. Chairman, and I thank the gentleman from Bedford for that recitation of the bill. I think when we all saw the horrific murder of George Floyd, and we all felt the pain that came with it of a failure of a government system, I started and embarked on immediately on determining how and why this may have happened and how we could correct it here in the Commonwealth of Virginia. One of the things that I've read extensively, and I recommend to the chair and also to members of this committee and also to the entire Senate, is a 2006 report from the United States Department of Justice called Citizen Complaints About Police Use of Force. Mr. Chairman, members of the committee, the person who murdered George Floyd, Derek Chauvin, at the time in which he put his knee onto the neck of Mr. Floyd, had 18 prior complaints filed against him with the Minneapolis Police Department for excessive force. That Minneapolis Police Department, Mr. Chairman, members of the committee, is unionized. And to the extent that we can only find out from what we can glean from any record, there is basically no record of the disposition of those 18 excessive use of force complaints. Derek Chauvin was on the Minneapolis Police Department for 18 years. So that was a complaint about once every year. And yet it is only known that two letters of reprimand were given, and then it is unknown whatever happened to the other 16. Now, we are addressing those bills through the Judiciary Committee, and certainly they should be considered to make sure that we are transparent. But what we found, and when I did further research, is that the incident of Derek Chauvin is not exclusive to Minneapolis. But it is, Mr. Chairman, common thread in those police unions. By way of example, Mr. Chairman, members of the committee, in 2018, University of Oxford studied the 100 largest American cities and found that the extent of protections in police contracts was directly and positively correlated with police violence and other abuse against citizens. A follow-up 2019 University of Chicago study found that extending collective bargaining rights to the Florida Sheriff's Departments led to a 40% statewide increase in cases of violent misconduct, translating to nearly 12 additional such incidents every single year. When I looked into the Minneapolis Police Department, which is unionized, only 1.5% of the complaints filed against the Minneapolis Police Department, Mr. Chairman, have resulted in suspensions, terminations, or demotions of police officers, and that's just for the period between 2013 and 2019. This was a study I read from CNN. They had reviewed the City Office of Police Conduct Review, and they had reviewed, and as much as they could, what was allowed because most of the information was held secret, but that there was over 2013 excessive force complaints against the Minneapolis Police Department between 2013 and 2019. I also found in this Federal Bureau of Statistics special report in 2006, this report found that unionized police agencies garnered 9.9 use of force complaints for every 100 officers, compared to a 7.3 for non-unionized agencies. As a result, and even when we look at other investigations, what we find is that there is a stunningly high percentage of officers that are even then, when fired for misconduct, are eventually rehired after a lengthy appeals process, which is mandated by the collective bargaining agreement that the union, the police union, has struck with the locality. In Washington, D.C., 45% of the officers fired for misconduct from 2006 to 2017, 45% were rehired on appeal. In Philadelphia, that number rose to 62%. In San Antonio, I found that number of rehiring was over 70%. All of these rehirings were mandated through forgiveness programs and rehiring programs through collective bargaining. If there was no union that would have protected Derek Chauvin, a bad cop in Minneapolis, then most likely George Floyd would still be on this planet today. When we are looking at the core reasons and the core solutions that come from what happened to Mr. Floyd to ensure that it does not happen in the Commonwealth of Virginia, this, as I would agree with the gentleman from Bedford, is the most effective way for our police agencies, for our sheriff's departments, to be able to remove the bad cop off of the street and away from being able to harm anyone or to corrupt the system. Quite frankly, and I want to make sure that we're clear, this is not an anti-union bill. My mother likes to say there is a time and place for everything. But I would urge the members of this committee to consider that there is no special need for a union in law enforcement in the Commonwealth of Virginia. There is no reason that we should stand here today and allow an entity to protect a bad cop who then can hurt a citizen of our Commonwealth. And so for those reasons, Mr. Chairman, I would urge passage of the bill, and I thank you, sir, for your kind consideration.
Mr. Chair.
Senator Spruill is next.
Thank you, Mr. Speaker. Can you hear me?
Get closer to the mic.
What's his buttons? Thank you, Mr. Chairman. Brother Stanley, I'm going to call him that because I want to. It's after the union. We don't have the unions in Virginia right now. So that's the case. Then tell me how come the 2 or 3 murder cases by policemen that we had in the state of Norfolk, they're not unionized? Tell me how come the case that we had right here in Richmond, they are not unionized? So you're saying that because they are union, if they were union, this stuff won't stop by police officers. No way. All the problems that we're having right now in Virginia by policemen and others, they're not unionized. So how do you rectify that? So it doesn't matter whether they're union or not. If they are bad, they are bad. And by the way, all policemen are not bad. But you know that. They're all not bad. I understand that. But don't hide by saying if they're the union, they're all going to be bad. There are some bad right now. We don't have no union. So I can't support this because my brother, my friend, is trying to use that as an excuse to saying not to have a union in Virginia. Thank you so much.
Mr. Chairman, if I may respond. Mr. Chairman, if I may respond. Mr. Chairman, and I will address the fellow senator as my brother as well, and I love him very dearly. This is not an anti-union bill. This is not going to stop bad cops from being bad cops. But what it does is it prevents a structure from protecting bad cops. It prevents a structure from keeping the head of a law enforcement agency from taking decisive action in removing that bad cop, not just from the street, but taking away their gun and their badge. This is a simple measure that is not anti-union. This does not strike down anything in terms of the collective bargaining at the local level law that you all passed. And certainly I'm not anti-union. My whole father's side of the family was UAW. It's not about that. But some areas of employment, unions may not be as effective as we think they will be in other areas. And when the gentleman says that, what about the murder that occurred here with a police officer in Norfolk, or what about also in Richmond? And they weren't union. Yes. And I hope that if they are found guilty, that those people who committed those heinous crimes under the color of state authority go to jail. But we are at a crossroads where we have to look and find solutions that will prevent Derek Chauvin, from ever walking a beat on the streets of the Commonwealth of Virginia. This is just one way to do it. Or if we're not going to make sure that this doesn't happen, that these unions can't protect these officers and keep them on the street, then I don't know what else we can do. Quite frankly, the facts that I read, Mr. Chairman, to everybody here demonstrate clearly, and these are facts from the Washington Post, studies from the Washington Post that I read, studies from the U.S. Department of Justice, demonstrate that when there is a unionized police force, that the rates of violence against citizens and excessive force precipitously increase. And I thought we're here, and I would submit we're here, for the reason that we're trying to make sure that it decreases with de-escalation tactics, with other things that you all proposed. But this taken together is a measure which then will protect the citizenry from a bad cop when, if there's an entity in place like a police union, that might protect the police officer as a part of the collective bargaining agreement. Thank you, Mr. Chairman.
Mr. Chair.
Senator Servell.
Mr. Chairman, Mr. Deeds was ahead of me in the queue. If you want to do him first, come to me. That's
Chris,
fine.
I wanted to ask Senator Stanley a couple of questions, if I could.
Sure.
Now, number one, Senator, yesterday in courts of justice, Senator Locke had a bill that would have allowed, that one of the purposes was to allow localities to share information about police officers from when they were applying for other jobs to keep bad cops from being rehired. I wonder if the senator voted for that bill.
Mr. Chairman, I'd answer the gentleman that had that been a standalone bill that he just described, the ability to share information so that police agencies were not passing the trash between themselves, if that was a standalone bill not collectively grouped with other bills that I did object to, then yes, I would have voted for that bill.
But the gentleman did not vote for that bill. Is that correct?
Mr. Chairman, I'd answer the gentleman by saying this senator did not vote for this bill because of the other things that I found objectionable
Mr. Chair,
to law enforcement.
I'd ask the gentleman if there's anything about the bill that the chairman carried this past session that mandates local police unions be recognized or collective bargaining be employed by any local government.
Mr. Chairman, I'd answer the gentleman by saying your bill, which allows collective bargaining, does not prohibit collective bargaining for the different state agencies, state employees or local employees, and those include sheriff's departments. So while it is not in there specifically allowing for unions with law enforcement agencies, as a lawyer I can tell you that by having it not in there, it doesn't prohibit them. And one could assume, Mr. Chairman, one could assume that without prohibitive language, that those unions are a possibility and could have a terrible result for our citizens.
Senator Stanley, my bill applied only, and I mean only, to local government.
Mr. Chairman, I recognize that, and if I use the word state, I meant local.
And Mr. Chair, your bill only allows the local government to recognize. It's a local option. It's not a mandate of any kind.
Mr. Chairman? Comment? Mr. Chairman. Mr. Chairman? Mr. Chairman.
All right, Servell, and then Senator Edwards.
Thank you, Mr. Chairman. Speaking to the bill. First of all, I think this bill is kind of a sledgehammer going after a nail. I would agree with the gentleman that there's been some studies, I believe, that show that union involvement in discipline has been a problem. And that might be a solution worth discussing. But banning the unionization of law enforcement is complete, total overkill. Our police officers are not paid enough. Their salaries are too low. They are asked to do things, they're asked to do jobs that they probably shouldn't be asked to have done because they don't have people advocating for them in local government. Let's give you an example. Fairfax County, which is not the wealthiest, but one of the wealthiest jurisdictions in this Commonwealth, pays the average or starting salary for police officers $51,000. After taxes, that's maybe $40,000. Average rent in Fairfax County is $1,800 a month. That's $20,000 a year. A police officer in Fairfax County can't afford to live in the county they're required to police. And if they had an organization advocating for them, they might be able to get paid a salary worth what they do every day. They need that advocacy. They need the advocacy for the benefits. They need it for workers' comp. And again, we can have a debate about whether or not they deserve, or whether or not we ought to authorize or prohibit local governments from collectively bargaining and involving them in discipline, but that is a different issue. And as the senator from Bath pointed out, our senators, the senior senator from Fairfax County's bill last year was local options. So our localities are not required to collectively bargain in a way that involves them in discipline. If our localities don't want them involved in that, they can get out of that. They can opt out of that. So this bill is drafted is a complete, total overkill. The idea that law officers don't need unions is preposterous. They need it. They're not paid enough. And Mr. Chairman, I would hope we would defeat the bill as it's currently drafted.
Mr. Chairman.
Senator Edwards and then Senator
Mr. Chairman, last winter, and it's in the bill, effective May 1, 2021, we passed legislation that authorizes, at the option of localities, to bargain collectively with some of their employees. This last night, we spent 2 hours. Senator Locke's legislation, landmark legislation, I might say, that would provide for model training, model certification, decertification, and the sharing of information. The underlying premise of this legislation here is if you have a union, you automatically have bad cops, or the unions will create bad cops, or unions will support bad cops. That is undercut by logic, but also by the fact that last night we have sharing of information. It's not going to happen if we implement what we passed last night with Senator Locke's legislation. I think this bill is not just overkill. It undercuts the whole assumption that unions are going to somehow support bad cops. If they ever did, and I've heard stories about that as well, but last night's legislation would prevent that from happening. And I think this bill is a useless piece of legislation. I hope we kill it. Did I make myself clear?
Thank you, Mr. Chairman. It's easy to get ramped up about this stuff, but of all of the bills and all of the legislation being proposed during the course of this session, this is the bill and the legislation most likely to get rid of bad cops that is going to be introduced in either chamber of the General Assembly. It is indisputable that police unions and collective bargaining keep more bad cops on the job across officer in Minneapolis in overturning disciplinary action. I think this is a great measure, and it's an opportunity for us to make a real difference rather than hanging window dressing.
Thank you. Is there anyone else who desires to speak on Senate Bill 5027?
Mr. Chairman, if I could just wrap up.
Senator Newman.
Mr. Chairman, we went through this exercise 6 months ago, and when we did, we were talking about in the committee room law enforcement. Now, it ended up getting defined as a constitutional officer, but 6 months ago, I would tell you that this was the intent at the time. And honestly, I sit here amazed at what the senator from Rockingham just said. I hope he's wrong. I hope the legislation that's coming forward, which I have not seen yet, does not give an express get out of jail free if you do bad things, if union gets you out of it. If that's in the bill, then we need to pass this legislation. Mr. Chairman, I think that this is one of those defining times where if we think we want to have an ability to get rid of bad cops, we do it with this legislation. If we are not quite serious about that, then you leave the provision that appears to be in the other legislation there, and you kill this bill.
Have you got any bump on that coming from Sarah on that meter? Have you got anything on that meter, Kyle? Nothing on that meter? 1, 2, 3. What? No public comment. Nobody. You said no one was okay. We're working.
All right. Anyone else desire to speak on Senate Bill 5027? If not, we need a motion. All right, there's a motion.
Substitute motion.
Is there a second? Motion and a second.
Substitute motion.
Substitute motion, Senator Lee.
DBI.
Second. Move the previous question, Mr. Chairman. The previous question been called. Go ahead.
What's the question?
The previous question was to report the bill.
Sure, I think that's the vote on whether they call the previous question.
All right. Go ahead.
Senator Norman.
So what's the question?
This is to call the previous question.
Senator Newman. Senator Obenchain. Senator Lucas.
No.
Senator Sproul. Senator Edwards. Senator Deeds. Senator Barker. Senator Marsden. Senator Evans. Senator Lewis. Senator Serval. Senator Mason. Senator Bell. Senator Sadler.
No.
Ayes 3, no, 12.
All right, the motion now is a substitute motion that's before us, and that's to pass the bill by indefinitely. Clerk, call the roll.
Senator Norman. Senator Newman. Senator Obenchain. Senator Lucas.
Aye.
Senator Sproul. Thank you. Senator Edwards. Senator Deeds. Senator Barker. Senator Marsden. Senator Evans. Senator Lewis. Senator Serval. Senator Mason.
Senator Cavola. Paid leave.
Thank you, Mr. Chairman. This bill deals with paid sick leave only during a governor-caused public health emergency. There are some line amendments, and I would like Thomas Stevens to read the line amendments, and I ask that they be adopted.
Thank you, Mr. Chairman. Senator Cavola, online. Line 95 after work, strike A, insert except provided in section 3.1-33.4A. Line 114 after A, insert minor. On line 135 after section, strike 40.1-33.7, insert 40.1-33.8. Line 174, insert paid time provided in accordance with 0.1-33.4 shall only be used in one consecutive block of time. On line 174 after time, insert provided in accordance with section 41.1-33.5, and those should be online under bill momentarily.
Mr. Chairman, I ask that the amendments be adopted.
They're technical in nature.
Amendments, I think, can be made.
Okay, you all heard the amendment, those in favor of adopting the amendment, say aye. See, Senator Cavola.
Okay, thank you, Mr. Chairman. What this bill does is it would require paid sick leave only during, as I mentioned earlier, a governor announced emergency order for a communicable disease, or what we would say a public health emergency. It would cover employers, public and private, but it exempts small employers, and that is defined as employers with 20 or fewer employees. So that's essentially, according to the Small Business Administration, their analysis of Virginia's businesses, 88% of small businesses in Virginia would be exempt. What the bill does is it would require up to 2 weeks to be taken one time while this bill is in effect. Again, it's in effect only during an emergency. It would allow up to 2 weeks to be taken at the same time and to be taken one time for COVID-related diagnostic treatment or quarantine. And it discusses a full-time employee as an employee working 30 hours or more, which is the ACA definition. That full-time employee could take the full 2 weeks. A part-time employee is defined as working 20 hours a week, and that at least 20 hours a week. So you would be talking 20 to 30 hours a week. And that part-time employee would earn the leave within the 2-week period. That would be equivalent to what that part-time employee would normally work in a 2-week period. We call this a family healthy bill because we would also allow the employee to take leave if a child was also suffering from a contagious disease and needed treatment. The employee could take the 2-week one-time allotment for that, to care for a child, to care for a grandparent, or to care for somebody where the employee was actually legally responsible for providing care. Additionally, the bill would require 5 days, capped no more than 5 days, of sick leave or paid time off, again, to be used for COVID-related impacts, and this would only be available to full-time employees. So a full-time employee would get up to 3 weeks to deal with COVID-related impacts, whether they're health-related or family-related. And the additional 5 days could be used, for example, to care for a child whose school may have closed
to care for a child where the child care situation is tenuous, or to take time off because the child needs assistance, actually, with the online learning, has examples. This bill is a floor. Most businesses offer considerably more than what this bill would require. This bill, again, would expire when our emergency order expires. It would not kick in again unless the governor had to announce sometime in the future another public health emergency. There is no deadline currently on the governor's emergency order for phase 3. I just wanted to put that out there. I will say that businesses and nonprofits and, of course, workers, our frontline workers, are very excited about this bill because they are fearful. They're being exposed to COVID. They're folks who are, there are delivery people. They are working in child care centers. They are working in janitorial services. They simply do not have access to any sick leave. We're talking a high proportion of these individuals are Black and brown people. They want this safety net. Their employers want them to have this safety net. Employers are not opposed to this. They have acknowledged it is a financial concern. So the governor has identified a fund, and it's called the Rebuild Virginia Fund. $70 million has already been allocated to this fund. It is available only to small businesses with 25 employees or fewer. My bill already carves out those at 20. And certainly paid sick days is one of the categories that employers could use these grant dollars for. So that is a very important element to this bill. There are only about 50,000 businesses with 21 employees up until 25. So the impact on employers affected by my bill who would be considered small businesses, I don't think is that wide or deep. And again, these folks can apply for this Rebuild Virginia grant as long as they did not get the federal PPP, the Payment Protection Program. I know there are people in the chat room who want to speak. I won't read the 40 organizations that are supporting this bill. I'll just give you a small flavor. Some of them will be disappointed that they won't be able to give remarks, so I'll go ahead and read them. The ACLU supports this. Birth in Color, RVA, Care in Action, CASA Virginia, which is a court-appointed special advocacy program. The Virginia Teachers, American Federation of Teachers, Virginia chapter, the Eastern Atlantic Council of Carpenters, Freedom Virginia, Legal Aid Justice Center, Rise for Youth, SEIU 512, the Virginia AFL-CIO, Breast Cancer Foundation and other health groups, Virginia Interfaith Council, Virginia Organizing, Virginia Poverty Law Center, the Virginia Conference of the United Methodist Women, and Voices for Children. So it's been a very diverse group, and it was a pleasure working with them.
Diverse group.
I'm happy to answer questions. I would respectfully ask that the committee report the bill and re-refer it to Finance, because the $70 million is sitting there, and Finance would like to hear the bill.
Okay. All right. Any questions by the members before we go to the public? All right. There are
Mr. Chairman, I'm sorry, there's one more part of the bill which is really important. I apologize profusely. The bill does prohibit the discharge or demotion or any discrimination against an employee who does stay home and is not covered by sick leave. And I had that in my notes, but that's an important part of the bill as well. I apologize.
Okay. There are 17 people, at least, that I see here who've signed up to speak either in favor or in opposition to this. And you all, I'll give each one of you about a minute. So say what you need to say, whether you support it or you don't. But we've got to move this on. So the first person on to speak is Thomas Calhoun.
They've dropped off, Senator.
They've dropped.
You can go to the next one.
Next one. All right. The next speaker is Karen Addison.
Good afternoon, Mr. Chairman, members of the committee. This is Karen Addison with Trauma and Standard Strategies, representing Freedom Virginia, an organization dedicated to improving economic security for Virginia's families. We support Senate Bill 5076, and I will let the rest of the folks speak behind me.
All right. After Karen Addison, the next person is Kim Bobo.
Good evening, Senator Sasson, esteemed members of the committee. Thank you for hearing this bill. I'm the director of the Virginia Interfaith Center for Public Policy, and we support Virginia having a paid sick day standard. This standard is critical, especially in the midst of a pandemic. Front page of the RTDs today quoted Dr. Danny Abdullah, director of Richmond and Enrico Health Districts, as saying, the lack of workplace protections helped spiral the impact, forcing Black and Latino communities to make a choice between staying home and risking being fired or go to work and potentially getting sick. Just the available of paid sick leave, that policy measure would have had a significant change in the way low-income residents responded to isolation and quarantine recommendations. They wouldn't have had to choose between money to support family and minimizing exposure. This is a critical policy choice at this moment. And we are so thankful to Senator Favola for her leadership and tireless support on this. And we look forward to working with the committee on a long-term package for paid sick days. But right now, this short-term temporary policy is exactly what we need, and let's do it. Thank you so much.
Thank you. The next speaker is Luis Aguilar.
Good afternoon, members of the committee and chair of the committee. I'm Luis Aguilar, Casas Virginia Director, and today I speak on behalf of our 10,000 members. We're having a lot of total of 109,000 cases of COVID-19 across the Commonwealth. Do we leave these Virginians to their own destiny, or do we provide them with paid sick leave that all Virginians deserve? 34.8% of those cases are by Latinos, 32.1% are by whites, 25% are by Black people. COVID-19 is not discriminating by race, but it is clear that it is the most economically disadvantaged, the ones who are suffering the most. Here is the story of one of our members, Jose Castillo of Falls Church, Virginia. He works in the construction industry. He and several workers tested positive about a month ago. He had to self-quarantine and took home no pay, risked losing his job, earned no income while making the tough decision to stay at home for the protection of others and for his recovery. On top of having no health care and the lack of governmental support, he lost wages because he is a working class person. The federal government has failed him because he did not qualify for any CARES Act support. I urge this body not to fail him as well. We, as CASA, ask you to support SB 5076, sponsored by Senator Favola. We support the concept, and we believe that every single Virginia worker deserves paid sick leave. We call them essential. Let's send the message that they are. Thank you.
Thank you. The next speaker is David Broder. David, you're up.
Thank you. Good evening, Mr. Chairman, members of the committee. My name is David Broder. I'm proud to serve as the elected president of SEIU Virginia 512. On behalf of our home care workers and public service workers, I speak tonight in support of SB 5076. All hardworking Virginians need paid sick days. It's that simple. And when essential workers, whether they're home care workers or bus operators or child care providers, when they lack paid sick days, every one of us in the community suffers. when home care workers lack paid sick days, it's not just them and their families that suffer, it's the older adults and people with disabilities that they're providing quality hands-on care to, they suffer as well. Anyone who comes in contact with them on the bus or at the supermarket suffers as well. And so we ask the committee tonight to support this bill so that every one of us can emerge from the pandemic safely and so that all of us can get back to our lives with a stronger economy for all Virginians. Thank you so much.
Thank you, David. The next speaker is Karen McElfish.
Thank you, and good afternoon, Senator Sasson, distinguished senators. As a pediatrician and as the social action coordinator for the Virginia Conference of United Methodist Women, I support paid sick days. Virginia Conference United Methodist Women have units in nearly 1,000 congregations across the state. We've written letters and emails in support of a paid sick day standard. We believe it is especially crucial in this time of a pandemic that employees are not compelled to go to work sick for lack of time off for themselves, to care for themselves, or to send sick children to school or to childcare for lack of paid time off to care for them. This greatly increases the risk of spreading COVID-19 or other contagious illnesses throughout the workforce and the community. Even though I represent United Methodist Women statewide, I also am a constituent of Senator Favola, and I personally want to thank her for her leadership on this role. Thank you.
Thank you. The next speaker is Greg Ackerman.
They've dropped off, Senator. Next one. Go to the next.
All right. Mr. Ackerman's not there. The next speaker is Megan Healy.
They've also dropped off.
All right. The next speaker is Allison Gilbraith.
Good evening, Mr. Chairman, members of the committee. Allison Gilbreth with Voices for Virginia's Children. We champion public policies to benefit the lives of Virginia's children. We strongly support this bill. We are speaking for children today, and we are trying to ensure that young children especially are not at home sick because their parents have no choice but to go to work, or that older children are taking care of younger children. We want to ensure equitable outcomes for all Virginia's children. Therefore, we support the bill. Thank you so much to the patron for bringing it forward.
Thank you. The next speaker is Nicole Riley.
Hi, Mr. Chairman. Nicole Riley with NFIB, representing about 6,000 small business owners here in Virginia, but I'm also speaking on behalf of a business coalition of 30 organizations. We actually really do have some serious concerns and would ask the committee to defer any action on this legislation at this time, and to be brief on a couple of the reasons why. Number one, Virginia employers are already required under both federal and state regulations at this point to provide paid sick leave. And of course, many of our members have taken steps to accommodate our employees. And so we just think that putting in a third layer could add a lot of confusion. And some of that confusion is, frankly, when you look at this particular bill, we really actually think that it doesn't necessarily, that all of the paid leave that's being required is just during a pandemic. This second section there that starts, I think, with, I believe it is, with the lines starting at 93 through 116, this additional 5 hours for full time. It incorporates a lot of language from what was discussed during regular session. So it includes things like accruing, and it uses the same definition for a communicable disease that is not COVID-19. It could be for the flu. It could be for anything. It's also not clear that it actually does end with the state of emergency. It mentions that, you know, in the section that they get the 2 weeks, but there's no enactment clause or anything like that that definitively says it would end with a state of emergency. And so, you know, for those reasons, because it really eliminates flexibility for employers to do the best that they can for their employees, and creates a lot of reporting mechanisms and things like that.
You need to wrap up.
I will. Then we would ask that you would not move this forward. Thank you.
Okay, thank you.
Mr. Chairman, can I respond later to those comments?
The next speaker after Ms. Riley will now be Beck Stanley.
Thank you, Mr. Chairman. Beck Stanley for the Virginia Agribusiness Council. We do still hold serious concerns. Agriculture and forestry, as you know, is a supply chain that is seasonal, and a burdensome policy like this would be especially difficult to implement in agribusinesses around Virginia. So we do align ourselves with the Coalition for a Stronger Virginia Economy, and we ask you to defer action right now.
Okay. Thank you very much. That's Mr. Stanley. The next is Robert Melvin.
Mr. Chairman, members of the committee, thank you very much for your time today. I'm with the Virginia Restaurant, Lodging, and Travel Association, and our members have, I'm sure you've heard just the impact that the COVID-19 epidemic has had on the hospitality industry. We're anticipating that at this point that 25% of restaurants are going to be closing across Virginia permanently, and that is out of approximately 15,500 restaurants. Our folks are really having a challenging time already with the regulations and requirements that are in place, and we share the concerns that Nicole Riley made about the confusion, and you know, our folks have really very limited ability to pay for additional mandates at this point. So we strongly urge you to oppose this measure. Thank you.
Thank you. Robert Melvin. The next is Jody Roth. Welcome, Jody.
Hi, Senator. Mr. Chairman, thank you. Jody Roth on behalf of Virginia Retail Federation and its members across the Commonwealth. We strongly oppose this bill. We have great concerns with the two mandate for paid sick leave that is established in this legislation, and just want to associate myself with the comments by Ms. Riley in an effort to save time. Most of our employees are really struggling hard, as well as the employers are also struggling with them. And our business owners understand that their employees are their greatest asset, and they're doing everything they can to accommodate them during these difficult times. And this would add just another third layer of confusion for business owners on top of what the feds have already done and what the state has done. And so for all those reasons, and the reasons mentioned by Robert Melvin as well, we oppose and hope that you will defer this bill right now. Thank you.
Thank you very much, Jody. The next speaker is Clayton Medford.
They dropped off, Senator. You can say.
Okay. The next speaker then will be Marcia Tedderton.
They also dropped off, Senator.
The next speaker then would be Keith Martin.
Hi, Mr. Chairman. This is Keith Martin with Virginia Chamber of Commerce. Thanks for the opportunity to speak.
With the who?
The Virginia Chamber of Commerce.
Okay.
As you know, many businesses offer a generous benefit package. Mercer recently conducted a survey of Virginia employers and found that anywhere between 60 and 65% of employers are providing some sort of leave program, whether that's PTO or some kind of combination of sick leave and vacation time. We have recently talked to many of our employers in the state, and they're concerned that this bill will actually inhibit the flexibility that many of them offer their employees. About 40% of employers offer flexibility to use their leave for such things as childcare, take care of a family member, things of that nature. And so we're concerned that this bill will discourage employers from offering a flexible leave package. So for that reason, we oppose the bill.
Okay, thank you very much. The next speaker, I think the last that I have here, is Dale Bennett.
Mr. Chairman, members of the committee, Dale Bennett with the Virginia Trucking Association. In the interest of time, I will just associate our position with the remarks of Ms. Riley on behalf of the Coalition for a Better Virginia Economy. We are concerned about this additional mandate when we're already subject to the federal leave requirements as well as the flexible leave policy required in the new Daliot regulations, and ask that you defer action on this bill. Thank you.
Okay, I believe that's the wrap up for public testimony.
Mr. Chairman, can I ask Senator Favola a question?
Senator Deeds.
Senator, in many parts of the state, the economy is as bad as it's been in our lifetimes. And I'm wondering, I want people to get additional money too. I want people to be able to take time off from work when they're sick. But I wonder where this additional money is going to come from.
Mr. Chairman, the governor's office set aside that $70 million. I believe it is one-time federal money that has to be spent. This is a one-time requirement. It doesn't need ongoing money. The $70 million has already been set aside. It's in the governor's budget. I worked with the administration on this, and I just have a few additional comments to make.
Well, Mr. Chair, I'd like to ask, does this bill run out when the $70 million runs out?
This bill runs out when the executive order on a public health emergency runs out.
So whether we're through $70 million or not, it'll run out then.
$70 million doesn't even come close to covering what this cost would be.
Mr. Chairman.
Well, if I may, Mr. Chairman.
Hold on, Senator Newman has a question.
Mr. Chairman, I think there may be some confusion. The $70 million covers the state portion. Is there a portion of the $70 million that covers private businesses that is not in what we're anticipating taking up in finance?
According to what I have received from Megan Healy, the $70 million is available to the private.
That's not my question. Mr. Chairman, I think the senator from Bath asked about the money running out, and the fact is that the $70 million just covers a portion of the state portion of how much it's going to cost us. But his question, I think, was how much is it going to cost businesses? Is there one penny in the budget for how much it's going to cost private businesses?
Again, I have a different understanding of that. I was told that this would not have, my bill would not have a fiscal impact on our state agencies. They are already budgeting and have already budgeted for COVID leave, that the $70 million was put aside for small, it's called Rebuild Virginia, and under the Rebuild Virginia language, it is directed to small business, and they may apply under 5 categories. They can cover paid sick leave, they can cover any kind of payroll support, they can cover mortgage payments, they can cover interest on loans, they can cover PPE. So under Rebuild Virginia, that is a program directed to small businesses. Again, my information's only as good as what the governor's office has shared with me. I will find a note from Emily, and I will read it to you directly. This is Emily Elliott. She's the director of the Department of Human Resource Management for the state. And she says the state public health emergency leave policy is more generous than Senator Favola's. Mine's only expected to be a floor. Virginia provides up to 80 hours and then authorizes another 80 hours for a total of 160 hours of leave. It can be used for self and family members. They also are covering part-time workers and some wage workers. I tried to be pretty specific. I don't want to put a burden on the state budget. That's not my goal. That's not the goal of anybody here. And I certainly don't want to overburden the private sector. The federal requirements expire December 31st for leave. This bill picks up January 1st.
Mr. Chairman.
Mr. Chair?
Yeah, let me try again, following up on Senator Deeds' question. And, I understand that this applies to private businesses with more than 20 employees, and the burden that's going to be placed on them will be under this bill. It's not on the state, it's not on local government, it's on those private businesses. But I think what Senator Deeds was getting at is what's the burden on these businesses? And correct me if I'm wrong, am I correct that the only people who qualify for funding under this Rebuild Virginia Fund are businesses who did not qualify for PPP funding?
That is correct. You are correct.
So, Mr. Chairman, a further point. So if there are businesses out there who got PPP funds and those funds are long since exhausted, they are going to still be required to provide this benefit, and not a single penny of that $70 million from the Rebuild Virginia Fund will be available for any of those businesses. Am I correct?
That is correct. That is my understanding. But again, okay, this would be one time. Most businesses are going to provide this anyways because they want to keep their workforce safe. This bill doesn't take effect until January 1. It would expire when the public health emergency ends. The federal requirements, of course, as you know, expire December 31st. I can't tell you exactly the number of businesses that would be affected by this, but I can say that this is a very reasonable bill, which most businesses are going to want to live by anyways. I think in the middle of a public health emergency, this is something we should do. And to the point that was made by one of the speakers, nobody in the Department of Health can find when the governor, when there was another public health emergency issued by the governor. This wouldn't cover flus. This didn't cover SARS. This didn't cover. I mean, if you go to the code 44-146.16, it's pretty tightly written. It has to be a communicable disease of gravity that somebody would consider to be a public health threat. So the fact that another public health emergency might come down the road, I hope, is pretty rare.
All right.
Mr. Chair.
Norman, and then Senator Surville. Then Senator Barker.
Thank you, Mr. Chairman. I hope that the other members of the committee who are listening very attentively to this from the business perspective of it heard what Senator Obenchain said. The repeated reframe that this is not going to put a burden on state agencies is irrelevant. The concern that many of us has is the burden that is going to be put on businesses. And you just heard that if you've taken PPP money, which I know an awful lot about, then you're not eligible. We considered this more general policy during the general session, and it was rejected. And it was rejected. And what I see as this proposal, altruistic as it is that it is the light version of what we previously rejected. And I remember we had a former senator with us who retired, who used to refer to these type of approaches as the amendment from Egypt. And the reason he referred to it like that is because sometimes when you can't get the primary legislation that you wanted, you come back with a lighter version, and it is the proverbial camel sticking its nose under the tent. And I assure you that if this goes in place, the next move, the next incremental effort is going to be eliminated the pandemic situation. This was not a business-friendly idea during the regular session, and it is a less friendly concept right now. Yes, just real quickly, I agree with the understanding that Senator Obenchain had in terms of if you took PPP funds, you could not qualify for these, but also that if there were local grants that were issued to businesses, and there are a lot of jurisdictions that have taken other funds, from the CARES Act, et cetera, you also would not qualify to be eligible to receive the Rebuild Virginia funds for this. So this is something that a lot of the businesses that might be impacted by this cannot
possibly be able to get grants from the Rebuild Virginia Fund to be able to address these costs. So it's not something that is simply going to be a wash to businesses. There are a lot of businesses that will be unable to access other funds for this.
Thank you, Mr. Chairman. Speaking to the bill. So, I think this bill comes from a good place and with good intentions. I'm not sure a special session is the right place to address this, though, is where I come out on this. First of all, I think it's important to remember that any law we pass is not effective until 4 months after we adjourn. Not the governor signs it, but after we adjourn. And I don't know what the current plan is because it requires 2 chambers to have a plan. But right now, it's not clear to me when we're going to adjourn. And if we adjourn after September 1, which I think is probable given what's happening, this bill would not be effective until sometime next year at best. If we don't adjourn until January the 10th, which is before the regular session, which is actually a common practice of the body whenever we go into a special session, this bill would not be effective until April or May, if it were to be signed and not amended. So, and first of all, I'm not even clear that this state of emergency is going to last till January 1. It's my hope that we have a vaccine by then and people have been vaccinated and much of this will have abated by then. So it's not clear to me that this law will ever do anything if it's passed as drafted in light of where we are on the vaccine and in terms of the effectiveness date. And so it strikes me, having said that this is a very big concept to sort of close our eyes and cross our fingers and hope that it maybe might sort of help somebody if everything sort of goes as planned, which is not clear to me at all that that's going to go as planned. And I've had a lot of businesses reach out to me in the last 8 hours, very freaked out by this because of how fast it's coming and how late it's coming. I've had people texting me who I haven't heard from in 10 years, telling me that this is going to require them to have to hire more employees. If people take this sick leave through the end of the year, it's going to run up their cost of business, not only to have to pay the sick leave, but have to hire more people to cover the people who call in sick. We looked at this last session, and this is really something that's better fit for a regular session and not a special. And that's sort of where I'm coming out on it. I think it's definitely something that we need to look at. It's definitely a benefit that I think we ought to consider. I think that Virginia employees do deserve some kind of sick leave, but trying to shoehorn it into this state of emergency situation, to me, it's like a game of Twister. I think sooner or later you put your hands and your feet on so many of those spots, pretty soon you get all twisted up and it becomes a big mess. And that's kind of where where this bill is getting. And I'm very uncomfortable advancing it in the present posture given where we are right now. I mean, to be honest, if this bill doesn't pass until, after September 1, after whenever the House sends it back, whatever, it's got a January 1 effectiveness date, which means it requires an 80% majority to make it law on January 1, because that would be emergency legislation. So, because there's a January 1 effectiveness date at the end. I mean, there's a lot of complexities here that I think, it needs more work, and it's for regular session.
Mr. Chairman, just briefly, I know that the proper focus has been on the private industry, but the $70 million is also very close to what a fiscal that we got on a similar bill very late. It may have been on the last day of session last year, and we cannot even begin the process of looking at the fiscal for state agencies because it's simply not available. I mean, it would have a tremendous impact on our budget as well. I know the gentlelady is very sincere. She's brought this many times, but I would like to move that we pass the bill by indefinitely.
Is there a second? Motion, the PBI. Is there a second? Second by Senator Marsden. Clerk will call the roll.
Senator Norman. Senator Newman. Senator Obenshain. Senator Lucas. Senator Spruill. Senator Edwards. Senator Deeds. Senator Barker.
Aye.
Senator Marsden. Senator Eben. Senator Lewis. Senator Servo. Senator Mason. Senator Bell.
No.
Senator Saslow.
Aye.
Senator Edwards. Ayes 13, noes 2.
The bill is PBI'd.
And I do appreciate the fact that the committee took a few minutes to hear this, and I appreciate the comments. I hope that we can form some study group where we do include business and many others and continue to maybe work through this issue. Obviously, we need more stakeholders at the table. So thank you, committee members.
All right, Senator Bell. Hold on, 3-5.
Thank you, Mr. Chairman. This is Bill SB 5085. And I will try to be brief. We've discussed this a bit today as we were trying to prepare for this committee meeting. I'll just give you a very brief summary and then make a recommendation, or I can make a motion and ask for a second on it. First, I'd like to say this bill responds to the current economic crisis, tries to bring some relief to people in the Commonwealth for utility savings, to help those who are behind in the utilities. It does really three things. It returns $250 million to all Dominion customers. The report which just came out today showed that there's been about $500 million of overcharging if you take out accounting for all retired plants in 1 year. It also establishes a $100 million utility debt forgiveness fund, which would actually help many Virginians who have accrued debt to the COVID crisis for their utilities. And it provides a long-term benefit in the Commonwealth by lowering future utility bills for all Dominion customers. This is a complicated piece of legislation, much like the last one. And having said that, in our discussions, my recommendation, my motion is to refer this to Utility Commission so it can be further looked at.
Mr. Chairman.
Senator Norman.
Mr. Chairman, before I second the motion, I just would like to remind the body I've got some casual knowledge in this particular area, and there's already a rate case matter that is pending before the SCC in March of 2021, and I expect that there's some latitude to address some of these issues from the policy approach that are in this, but I second the motion.
All right, motion is before us to refer Senate Bill 5085 to the Utility Restructuring Commission.
Mr. Chairman, Servo. I'm pretty sure the correct motion is a motion to PBI with a letter, I think. So I'm not sure we can refer it. I don't think there's a motion to refer. Is that right?
That would be correct. It would be a letter from me to the commission to put this on their agenda. All those in favor of that motion say aye. Aye. All right, that's it. I think if there's no more business to come before the committee will rise.